Hello, guys. My name is Richard Areba. Thank you so much for subscribing to my YouTube channel. And I appreciate you so much because I've seen a couple of people, some guys are watching my videos. I've seen uh, some friends are sharing the videos. I appreciate you so much. And excuse me. Yeah, today, um, I'm gonna make a video about one person or someone was asking me a question like, um, what are some of the times that I made a tough or hard decision as a registered nurse? And I think that's a very good question and a tough question at the same time because as a registered nurse, I've had to be in different difficult situations that need that I make decisions to move forward or being in a position to get to what you think is the right thing. So I have a couple of situations and different scenarios. I mean, I have my own like life experiences as a registered nurse and what I've faced. But in this particular case, I'm going to give just one, the marked one that I remember. There's so many in patient care, but let me start with this one. Maybe I'll do a series on the different difficult situations I was in. Uh, so today I'm going to start with I was in a situation where in 2014, late 2014, I saw an advertisement or we had news that there was outbreak of Ebola in West African countries. So in the particular situations when you see there's an outbreak of a disease in an area, just like, by the way, I think we now have good context now that we had the outbreak of COVID-19 and all the situation that was. So in 2014, when there was Ebola outbreak in West Africa, in a few West African countries, that was Liberia, Sierra Leone, Guinea, and a couple of West African countries, um, the African Union advertised positions for volunteers. This is one of the toughest decisions I've ever had to make in my life, and I had to go against everyone's will and desire. So I saw an advertisement on a newspaper that the African Union was employing registered nurses and other volunteers. It was healthcare providers, that was registered nurses, hygienists, medical doctors, clinical officers. So clinical officers are actually the equivalent of physician assistants in the US. So we had a lot of people needed for the crisis. And I think initially that was almost, I think, the third advertisement because the first one, it was around, I think it was around October or up and about September 2014. So they did the first advertisement and nobody responded. Like they could not get people to respond. They did the second one, and then I think we responded on the third one. And I put in my application and I saw what the requirement was actually. And I thought, and oh, maybe they may not even call me or whatever happens. I mean, just putting in an application at a glance to try and do something, at least to be of help to other people. That was the intention. And I put in my application. It was received and we waited. That was the end of 2014. So I didn't tell anyone that I had applied. I didn't tell, including my wife. I didn't tell anybody that I had applied. So I think it was towards the end of November 2014, they sent a response that I had been selected among many other people who were selected and were supposed apparently to travel and help. That was an initiative of the African Union that was named African Support for Ebola Outbreak in West Africa. One of the best initiatives that was put up by the African Union. I mean, many of the African entrepreneurs also, like, who was sitting in there was a committee that was in place to mobilize resources and money to buy protective equipment, mobilize transportation, and also like stipend for health workers and other things. Like, one of the renowned entrepreneur, African entrepreneur who lives in the UK, Strive Masihiwa, was involved, among many other people who were able to raise funds through the African Bank and other financial institution to support the program. So I went in for I don't remember, I don't remember even which, but the interviews, and then they were like hurriedly trying to get us travel without even having to think a lot about what had happened or what is going to happen to us. So initially, when I got that response, when you see most of these responses in the media, like for reporting in the media about Ebola outbreak, what you see is just terror. Like, you see a lot of United Nations ambulances moving around the cities. Most of the places there were curfews. People were never supposed to travel. They were supposed to be indoors. People were really like, there were curfew most times. The time I was there. So when they gave me the contracts, and then we signed that, you know what, we are in this. They came, and I had not told anybody about this. So I went and signed the contract, and I said, okay, I'm available. So after signing the contract, now that's when real problems started, like the tough decision that I had to make, because initially it was just, okay, maybe I'm not serious, maybe I've not made my mind. I was like, okay, let me just try. But reality hit when I realized that these guys, they came actually to the Sarova Stanley Hotel, and we signed the contracts, and now we were supposed to go. They had a date that was in January 2015 on the 9th. So they came, they gave us the contract, we signed the contract. They told us that, you know what, guys, on the 9th, you guys will be traveling, and we were going in a chartered flight. So I had to break this news to my wife. I had to tell my father. I had to tell my friends. I had to tell the people who were close to me. And this, I think, was the most difficult decision I've ever made in my life. When I told my wife, she thought I was crazy. She actually said no. Actually, my wife was pregnant then of our firstborn daughter, who was born in 2015 in August. She was she was pregnant in January. So I was like, okay, so what is wrong with you? Why do you want to go this place? I'm like, okay. I didn't even have explanation anyways. I told her that, maybe this is something good that I can do. I feel like I should go. She said no. I went to my supervisor, my then supervisor, medical office of health in the sub-county that I was working. And I told them that, you know what, I have this opportunity that has come, and it's supposed to be government secondment to the African Union. And what is going to happen? So you guys, am I going to be on the payroll, or are you guys gonna give us a, like, if it's secondment, of course, for government, we are supposed to remain on the payroll. So we had discussions, and I told them. So the release, I was supposed to get a release, and many others who also, we went together. We were supposed to get a release. The release was not the problem. The problem was that what kind of decisions are you guys making? You've been told that Ebola is a very infectious disease. There is, I think, bleeding from all orifices, and it's going to contact. So, how do you expose yourself and just go to the place where there is this infection to go and help? So the mantra for the job of the volunteer positions were, it was an African solution for African problems. So African solution for African problems. And then, in fact, it was a very noble innovation uh, around interventions for Ebola outbreak, because from the African support for Ebola outbreak in West Africa, that's where that's how the African CDC was born. We have now African CDC, just like the CDC, the main CDC that has guidelines on infection prevention and epidemiology and disease control, like, and researchers, they do lab works, they do respond during the pandemic and epidemics and endemic conditions. So I was like, okay, the flight is leaving on the 9th. So I told my wife, she said no. I traveled home and went and told my father. And I don't remember ever telling my mom, but I just told my dad, because I know my mom would obviously say no. So my dad asked me one question, like, what's wrong with you? What's going on? Why are you doing this? Where are you going? And this is December 2014. My dad was like, said, okay, this is the worst decision you're making now. I think this is not a good decision. And you see, it may be like, you see, do you watch the news? Like, do you see what's going on? So they got interested and then started watching the news on CNN. And then how CNN or other international media or media generally report such kind of issues. They only catch, like, the trending videos, and people dying in the streets and people bleeding everywhere and not being able to respond. And then people are so scared. Initially, during a disease outbreak, especially a disease that is not known, like COVID-19, before they put in, like, standard operating procedures for infection prevention, there's a lot of limbo. There's a lot of confusion. Like, okay, so what are the interventions? What do we do to protect ourselves? Is it, before they even classify the condition as being, either if it's contact, it's airborne, it's a droplet, it's whatever it is, it's bloodborne, which is contact anyways. Before they put those measures and guidelines and then define, there's always confusion, because everybody, they're scared. Because I remember, like, during the COVID-19 situation, the lockdowns came as a result of confusion and not even knowing how to intervene. Now you see, even the intervention is now, there are clear guidelines and there's ways to intervene, and it happened so swiftly. But for this particular case, it was the most difficult decision. So my dad said no, and I was like, what? So what's gonna happen here? I decided, okay, fine. I'm not going to tell anybody I've left, and okay, I'm gonna go, and whatever happens, happens. So I came and convinced my wife. She, I mean, like, accepted, agreed, but it was like, okay, if you insist, you do what you have to do. On the 9th, that was the most difficult flight to board. Even the flight. The flight at the Jomo Kenyatta International Airport that was leaving for Liberia, I have never seen people scared in my life like that day. We were so many guys on. It was a chartered flight. There was a stopover in Ghana. It was a 7 hours flight to Liberia, but we had a stopover in Ghana like for I think 30 minutes or so, or 1 hour. We were so tense and quiet in the plane, man. We were like, I remember most of the guys who were drinking alcohol. They drank themselves lame in the plane, and it was like quiet. I had like my headphones and listening to music, and I know, man, this is my last chance. Maybe I may never even come back. So when I went and got to Liberia, when we went to Liberia, we were a group of people, many people. We got to Liberia, and we got to Liberia at night. It was around 7:30 p.m. Darkness. So suddenly, contact precautions. We were like, you don't touch anybody. So I mean, you just let everybody stay away because you don't want to touch anything. Contact precautions. So we got there. My goodness, and the following day, then broad daylight now in a new country, by the way, again, the new different lifestyles, culture, the food, again, Liberia is West African country. They also don't speak Kiswahili, but, you know, we arrived, and, we were able to get used, and we intervened. We helped healthcare services in most of the private facilities and public facility. Mostly we did the work of recovery of health services in medical facilities. We went for WHO infection prevention training, and it turned out it was the best experience of my life. It turned out the best and the worst experience in my life, because one thing, my dad died when I was in Liberia. He was sick, went to the hospital. He died in March. That's a month or so later. And, the most difficult decision I've ever made in my life was that day. And my father, I used to, now when I got there, I called my dad and explained to him what's going on. He asked me, so what's going on there? He was surprised that you traveled. I told her, yeah, I did travel, sir. And he told me that, man, just take care of yourself. I know that it's gonna take time, and just take care of yourself, because we know that things are not good there. So do what you have to do, my friend. We worked with a lot of people. That's the first time I ever met other healthcare workers from different countries, from Nigeria, from South Africa. We met guys from Uganda. One of the mission lead, of course, is dead, was one of the army guy. I mean, it was a mission. It was a mission. It was the best experience of my life. And we did help a lot of people. We worked in medical hospitals and other outpatient clinics, and it was the best experience of my life. Even having to make that decision, and it turned out to be a blessing. And I know that it's never easy to make a tough decision. It's never easy to make a tough decision. And then, you see, when you make a tough decision, what I've realized, even in life, and most of the decisions I've had to make, is you have to try to solve a difficult problem, because that's how your life gets easy. Because if you solve easy problems, maybe, may end up living an average life. But if you really solve difficult problems, I think you stand a good chance to become, uh, to stand out and become better. And then, you solve more people's problems. And that's how you get resources for your own life sake. So man, that's one. Maybe I'll do another now, maybe in the hospital setup, a time when I had to make a tough decision. So it's never easy. It's never easy to make a hard decision. But you know, almost all the time in life and in our daily lives, in the time we meet people, we always make decisions. We always make that hard decisions. And it's always good to make hard decisions even faster so that you can move forward. Thank you so much. This is Richard Ogachi, and I would like to ask you kindly to subscribe to my YouTube channel and watch this kind of testimonies and experiences. And I know that you'll enjoy and have fun. Thank you so much, and see you next time. Bye bye.